can't let it go by. It's like, aren't you so glad? I mean, gosh, you survived, but we're trying to snatch that away from you. You've made it all the way to the end. It's like, now we're going to get you. Okay, I'm just messing with you. Don't take me seriously. It's my birthday, and Travis, my man, you know where we are. We slid in. All the Alabama hatred is at a red-hot intensity. We're okay, we can deal with it. We'll see. We might be in and out, but at least we're in for just a little bit. The capstone class, I'm sure you've heard some things from your classmates who are kind of, others in the program who are further down the road. A lot of what the class is going to be like this year is similar, but there are really some fairly significant changes in how it's going to be operational and what you're going to be doing. It's an interesting class because it has many different pieces, and they're all very important to concluding where you've been, all the things that you've been doing, and actually getting you ready to go out into the clinical practice areas, which I know you're excited to do. It's kind of like when you want to be a PA, you want to go take care of patients. And there's just all this information you have to deal with before you can actually get out there and do it. And you've had some exposures through Good Shepherd, and some other types of activities. But now we're going to start trying to pull together who you are, where you've been, and what you have learned to do in very practical ways. Add some more skills into your set so that you're at least introduced to and familiar with some other practice skills, and begin to orient you to healthcare systems. Because right now there's been a lot of focus on individual, what do I know and what can I do and can I pass these tests? But we have to start the transition from being in a classroom and just knowing things to beginning to see yourself as a practitioner inside a healthcare system of some sort as part of a group of team members, that take care of patients. And for those of you who've been healthcare providers before, you'll know there's what you do as a healthcare provider, but then there's all this other stuff you have to be aware of, the system, the rules, the foundations, and those will become very large parts of your life, whether you want to be involved with them or not. So we're going to get you involved with thinking like that through some activities in this class as well. This class has a lot of demonstration, a lot of show me. There is some self-learning that's part of it. There is some reviewing, kind of pulling things together. There are just lots of little pieces, but I think you will like the class. Most students do like it. There are some pieces I think that are anxiety-provoking. I can still look at the course and think about it as if I were a student in that class and go, ooh, that's going to make somebody nervous. Ooh, that's going to make somebody nervous. And there are some parts of this class that will make you nervous. That's okay. That's how you grow. I'm not necessarily from the Nike school of no pain, no gain, but I will tell you, when you're learning how to be a practitioner, no pain, no gain. And that pain doesn't have to be physical, but it's usually emotional, mental stress, and you have to be placed under it to kind of get to that next level. It's not done intentionally. Nothing that we do is, oh, let me think, how can I really mess you up? It's the fact that you do have to begin to show people what you can do independently, and you need to begin learning how to self-assess. We've got some things in this class where you can kind of self-assess, well, where am I now? Do I know things? Am I comfortable with this or am I uncomfortable? It's really a good time in your overall program to begin self-assessing very honestly and not being afraid to find what's the truth. Okay, if you know a lot of things, good. If there's some areas where you don't know stuff, that's okay, because that's normal. It's not abnormal, it's normal. There will be some places where you can do things real well, from a skill perspective, and there will be some where it's not so good. And you'll think, oh gosh, I don't know how to do that. Well, it's okay to be anxious about not knowing how to do some stuff. The most important thing is to know that you don't know so you can work on getting better. The worst thing is to just self-assess as I'm really, really good. Look at me. And then go out there and find out that's really not the truth. Okay. Is anybody in here ready to actually go take care of patients as an independent practitioner? Raise your hand if you think you are ready to go see a patient by yourself, do all the things that need to be done, and be completely confident that you're okay. Okay, there's two in the back of the room. Dang the button there. No, you should not feel like you can do that. Now, I'm not saying that to upset you. I'm just saying this is pretty much where it's supposed to be. There's an excitement about going into the clinical phase of training, and there's some nerves that go with it too. Okay, it's not, if you're feeling that way, I'm kind of ready, but I'm kind of nervous. I'm ready to get out of here, but then I'm there. You know, if you have all this little inside, outside little deal, good, you're normal. We got you right where we need you. People are not anxious when they think they know it all. Okay, if you just think you know it all, hey, I'm just going out there and just get this credential that I've already had all my life, and I just need the world to say it. This is how you get there. You have to kind of go out into the world and start learning how to do some things. Mess up, mostly, do right things, and begin to be very honest with yourself. There is a piece of being a practitioner that I think has kind of been implied up underneath everything all year, but really has never been said. But it probably does need to be said. We talk a lot about how to take care of patients, and you know, it's the most important thing. We're here to take care of patients. We want to take care of them well. We want to be smart, good, do the right things, be safe. All the things that you would want somebody to do for you if you were sick. You want somebody who knows what they're doing, who does it well, with a certain compassion and a style, all of those things. But the other thing up underneath that is that we always have to be growing and learning new stuff. That's just kind of part of being a healthcare provider. It's not all fixed in stone. No, we have not told you all you need to know. If you take your notes and feel like I know everything I need to know and they didn't tell me, get over it. Because there is no way to tell you everything you need to know. Never has been done, not supposed to be done. And the truth is, in about 5 years from now, about 25 to 30% of what you have learned will be changed again. Medicines change, techniques change, billing procedures will change, the world could change again. And if you blame your program, well, they didn't teach me that. We never could, we never have. We do all the best we can do to prepare you. And so this is, you know, kind of where it is. You know, graduation is not really called graduation. You know what the official name of graduation is? It's commencement. You know, it's always going to a commencement ceremony. What does commence mean? To start, to commence, to begin. Okay, so graduation isn't about being done. It's about being certified as capable of beginning. Okay, and then once you've been out there for 5 and 10 years, you can keep checking yourself, because all the ones that y'all know, y'all in practice, you know you don't know everything. And that's kind of what drives us a lot when we're teaching, is trying to somehow communicate, I want you to have tremendous confidence in these things, but I also want you to recognize that there's limitations. All practitioners are competence and limitations. Know your competence and be confident in it. Know your limitations and be equally confident in where you are limited. Only when you know exactly what you are and who you are and how you are, can you actually be a good practitioner. And all of you are making just fantastic progress. But this class will be drawing some things together, giving you the mirror to kind of see yourself. And you're all going to be successful. You're all going to make it. And we have not created these things to make you nervous. But we have created them to self-assess before you go into the clinical environment. Okay, so let me start running through this schedule, and then we'll kind of digress a little bit as we kind of get some details. And then we'll get to the syllabus where we'll get into even more details. But let's just look at what's going to happen and when. I loaded a lot of stuff into D2L. I actually changed the schedule, so if you printed this schedule off, there's just a few micro changes in it. But everything else I uploaded on D2L over the weekend is pretty legit. And there will be some other materials that we load into the folders, but it's pretty well set up. Okay, this is orientation, duh. Okay, this afternoon is actually in preparation for the clinical phase. Dr. McNeil and Professor LaVictoire will be here between 1 and 4. Maybe it'll get done earlier, maybe a little bit later, I'm not quite sure. But they're going to be going over lots of things you need to be aware of to get ready to go on to, you know, practice sites and rotations. lots of details. So that will be this afternoon, but what we're going to be doing this morning is pretty much getting set up for this class. Tomorrow, we will have a HIPAA training and credentialing early in the morning from 8 to 10. It'll be in-class presentation, but you also will take a test. You have to have, we talked about HIPAA back in January. We have to talk about it again and give you a credential that says that you're aware of HIPAA, okay? That you're aware of what it is and have basic knowledge of how to handle materials. And I know they're going to talk about some this afternoon, but I cannot emphasize enough. When you walk out of a clinical practice site, you better turn your brain off about who you saw, what you did with them, and who you're talking to about it. Because, 1,000 times in a row, it probably won't matter when you're talking about one thing or another. It'll be 1,001, and if you get hit, it will be bad. I can't tell you how bad HIPAA violation can be if you get caught doing it. So you have to start learning that professional behavior of lock it up when you walk out. Now you all won't be able to do it, but I'm telling you, you have to know who you're talking to, and you have to know what you're talking about. And for heaven's sakes, on social media, I mean texting, emailing, Facebooking, or anything, you better never talk about who you saw or what you did. Even in the most general terms, oh, I saw a person, it was the funniest thing, blah, blah, blah. You will not know who's what looking at that page. And you may have thought you didn't give enough to give it away, but it will be given away. And, just odd things are out there. So please, 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 never, even in the most vague way, talk about what you're doing in the social world, ever. I never email, I don't even like to email patients is dangerous. For heaven's sake, you don't know what you're doing. You got to find other ways to do it. Secure, whatever. Okay, enough on that. But we'll do HIPAA training tomorrow, and then there will be 2 lecture-type topics. One on lumbar puncture, which is what is it and how does it function, and some of the basic techniques. And then there will be one on central venous catheterization. When do you do that? Why do you do that? Just some broad techniques, and Dr. McNeil will do that. And then in the afternoon, there are 2 different groups. There's a 1 to 3 group, and there's a 3 to 5 group. So I would encourage you to pull up the schedule so you can see your name. And you will be doing LP and central venous catheterization during that session. There are cadavers over in the cadaver lab, and so you will be doing real things on real bodies to get a feel for it. Because simulations are not, when you're doing LPs, you need to see how far that needle goes in. It's kind of scary looking. And you're sticking things into places where if you don't do right, it's a problem. You go through, you penetrate, tissue. It's like, it's just going to be weird. So you have to kind of get a feel for it. Okay, so you'll do that. There is a sheet uploaded under all the skill developments that are going on where you have to have a faculty member sign off for what you've done. So there's, by the dates, there's a lot of stuff. I have to edit that sheet one more time. That's one thing I could not do. We came out of a meeting, we talked about a little bit more this morning. So don't print it off yet. I've got one more thing to add on there. But once it's ready to go, I'll just send y'all the class note saying it's good to go. That's what you will take with you. That is your ticket everywhere you go on skill development, all the way through Friday of next week when you go in to do sterile technique. But you have to have a PA faculty member, not a PharmD, but a PA faculty member sign off that you are doing it at the level that they would expect that a PA does whatever you're doing. Okay? And there will be a lot of faculty around when it goes on, and you need to have them sign it off. They'll check off that, yep, you've done that, and they've seen it, and they'll sign their name to it. This piece of paper you will need to cling to until the whole thing is over. Don't lose it. This is going to be a test. I will tell you, you have to turn that in at the end of all the skill development, and that will end up being a big part of your grade. Basically, if you just do everything and show somebody that you can do it and it's signed off, then you have met that requirements. We're not going to judge it, oh, you're excellent, you're good, you're whatever. It's not even for that purpose. It's the purpose of introducing. Do you have basic understanding of what this is? And do you have a basic technique that's good enough to start? to commence. And then you will have to turn that in to get that part of the grade. If you lose it, what happens? That's bad. It'll tell me one thing is that you don't know how to be responsible with an important document, and you're going to have like tons of important documents when you're on rotation. Notes, lab results, you have to hold them and you have to be sure that you can move them around. Last year, people lost things. I'm not going to get up in here and say, well, if you do this, you get this many points off. This is just being responsible. Everybody can do it, but you're going to have to take it with you, get it signed off, and hold on to it and give it back to me. If I do not get it back, I cannot complete the grade for your class. I will have no idea what you're going to do. You're going to have to recreate the whole trail. It will be a terrible thing to have to mess with, but it's something you can do. But don't take it, it's not trivial. And don't dink around, and I really probably won't be that understanding unless somebody steals your car, burns your house down. It'd have to be something big. But if it's just a matter of, oh, I just kind of misplaced it, don't. Just don't think about not having it. Keep it, you can do it. Okay. This was kind of getting heavy. Mess up and die. But I need that piece of paper, and y'all can all do that. So we have a series of skills going to happen. So tomorrow, beyond HIPAA training, where you will learn how to do it and be quiet about it, lumbar puncture, central venous catheterization, and then you will go over in your section and spend 1 hour on each of those. 1 hour on central venous catheterization, 1 hour on LP. Okay. On Wednesday, December the 6th, there's an AM and a PM session. You're not in both sessions. You're in one or the other. So that means you're going to have a half day every day this week. And I'll tell you what the other half is here in just a little bit. But the half day piece, you're going to be doing chest tube insertion and manual intubation. And there'll be a lot of folks there. Brad Smith will be there. I think he's taught y'all. Dr. Lovelace. There's a Dr. McWilliams. There'll be glide scope reps. That's another way to kind of visualize and look at things as you're trying to get tubes down. That'll be there. So there's an AM and PM session. Find out what your session is and then come. And this session will start at 9. On this day, Thursday, I have got to change this on here. There will be a session in this classroom for the AM people. There are morning people, and you'll need to be here from 8 to 8:45 a.m. And Professor Roark is going to be talking about injections, just some slide PowerPoint to talk about some of the things you're going to do with that. Ultrasound is taught inside the session, needle insertion is taught inside the session, but we have some classroom prep for some of the skills are done, okay? And I'll repost the schedule. Absolutely, we made some additional changes this morning, like right before I walked in here, so I haven't gotten everything out I want to get done. But on that Thursday from 8 to 8:45, Professor Roark will be talking about injections. And we're pretty much going to focus on, can you do a knee, can you do a shoulder, and those are two. We're going to do knee and shoulder.
Knee, shoulder, and probably lateral hip.
Lateral hip. Okay, so we'll look at that just so you can get a feel for it and see what landmarks look like and what you're going to be doing and how you do it, that type of a thing. And then for those who have the afternoon session on that day, it'll be a 12 to 12:45 in here, the slideshow. Then you have 15 minutes to walk over to the cadaver lab to do your thing on real bodies. So there's like a little prep scene before you go over. And I will put this back out again and let y'all know that that's going to be done. And then Friday, suturing is the same thing. Professor Lavic-Twa will be here from 8 to 8:45 only for the people scheduled between 9 and 12. And then there will be a 12 to 12:45 on suturing for those who have the PM session. That way you don't have to come in here and just wait all day. It's kind of like set up for the AM people, then there's a setup for the PM people so that you can maximize. If you're a morning person, you got the whole morning to do what you need to do, and there will be things you'll need to do. And then you come in to do your skill piece in the afternoon. Does that make sense how we're going to do that? Okay. And I think those sessions are good. We've added some of these things in since last year. I just feel like as much as we can orient you to some things verbally and with slides, it will be better than just walking into a room where it's like bodies. It's kind of harder to do it just verbally, even though most of those things you still have to do a setup before you do demo, you know, on a human body. Okay, then let's move on to the next phase here. Monday, Dr. Vanetta will be down here. There is a medical humanities thing that you will do. It's really a reflection on how you have changed because of medical humanities. He will talk about it in detail during that small block of time. It is not a graded activity, but it is something that you have to submit. So if you don't do it, you're incomplete. But it's not a graded activity where, oh, this is probably a paper, this is a B paper. It's not that. It's just your true statement of how do you think this has benefited you as an emerging PA practitioner. That's what it comes down to. And then that gets submitted. And it actually is going to be an anonymous submission. You don't have to write your name on it. In fact, I think it's supposed to be de-identified so that you just upload what you've done. He's actually doing a research project with this. He wants to find out how people have perceived it. And it is not about, oh, I don't like the grading, I don't like where we have to go do stuff, all of that. It's not that. It's really reflecting on what it has done. What does it do? Just what has it done for you and your self-identity as a growing PA? That's what it's all about. Just the honest statements, okay? If you don't like the fact you had to write a paper, it's got no place in this. It's just not what that's about. But he will look at it, and it has to be anonymous, because if we know who it is, then it's not, you can't be safe. So it's a safe activity. You don't put your name on it. Just write down how you think it's helped you change, and then they will actually evaluate and abstract, thoughts from this class. And I've heard y'all talk to me about this at some of the sessions, different times across the board, about the process of it. I've heard all of that, but I also have heard you talk about what you think it has been, how it's been useful. How you can't really get some of these situations in a lecture, but it's better to kind of talk about it as a group. So it'll be more of that type thing. Okay, so he'll do that very shortly. From 9:15 to 11:15, Dr. Latassi will do pain management. It really has not been done as I sing. There's been lots of little places where you talked about pain and what you can use for pain. But in terms of thinking about a process of medication selection, titration, how you work with these things, I don't think it's actually happened in a way that you can feel comfortable right now. So this is really kind of a setup before you go out. Y'all all know, if you read the paper at all, Oklahoma's in the middle of an opioid crisis, okay? And really, everybody in the intelligentsia of healthcare is watching people. If you read the paper carefully, lots of people are getting called in, some people are losing license, some people are getting suspended, some people are going to prison. There's a lot of stuff that can happen with opioid inappropriate use. But it's not about that per se, it's about how to use things safely and wisely. You want to help your patients, but you don't want to do things therapeutically that don't make sense and actually set your patients up for problems. So we're going to look at it like that and look at opioids as well as other things, non-steroidals, Tylenol. There's a lot of ways to treat pain, not just, Norco or whatever you want to do, hydrocodone types. Okay, so she'll do that. And then after that, we're just going to try to get out of here early, and I may get out of here before 1 o'clock. We're going to look at just public health. It's one of your accreditation standards, and we decided to move it more near the end before you do the jumping off point. I'm just going to give you an overview, introduction to that. I've asked Ron if he would talk a little bit, very frankly, about public health in his life experiences doing it. And if you've been reading the newspaper lately, the Oklahoma State Department of Health is having a terrible time dealing with limited finances, but seemingly unlimited public health problems. So if you read the paper, there's been something about every second or third day about people quitting, people leaving, underfunding, all these initiatives that have to be done. It's been pretty interesting. So I've talked to Ron just a tad bit about that, but I do want y'all to kind of hear about it. So as a PA practitioner in a primary care setting, you will be intimately connected to the ongoing big health themes across this state. It would be hard to avoid it. Then, Tuesday is starting IVs and performing venipuncture. There's a 9 and a 1 session. I don't think that we're going to have any in-class thing on that, but we might. I just don't think that that's what we have planned to do. But if somebody decides that they want to do that before they go in there in terms of faculty, I will certainly put that back on the schedule. But right now, that one you pretty much can teach by, you have to get in there and let's just look to see how you're going to do it. So I don't know if they want to do a slide presentation or not for that. So starting an IV and then doing venipuncture. There's an AM and PM session, and you can see that this is 7 p.m. Medical Humanities Final Reflection is due. There will be a portal for upload, and Dr. Vanetta will have told you about that the day before. So you hear about it Monday morning. You pretty much have Monday afternoon, Monday night off from stuff. Write down your basic reflections, upload to the portal by 7 p.m. and it's done. Okay? It's not intended to be a overwhelming, exhausting, stressful experience. Okay. Then on Wednesday, it's casting. Okay, this is not for a theater production. This is casting with like materials, you know, okay, broken bone type stuff. So there will be several coming here to do that, and there's an AM and PM session, and that I do not think there will be a setup for that because you really have to kind of look at your materials. Thursday, and I'm going to come back in a second once I get into my syllabus on this. On Thursday from 9 to 12, we have an IHI, that's Institute for Healthcare Improvement, big entity in the world right now, open school, and we're going to do an in-class activity that deals with healthcare improvement and patient safety. It's an in-class group activity. I will have y'all in groups of 6. We'll have a scenario, a health system scenario where you will have to apply some things you have learned from your online learning, which I'll get back to in a second. You will have to finish all of that online learning before Thursday of next week. So it's like 13 various topics. I think the total time is about 15 or 16 hours plus. So all those half days you're not in here, that's what you need to be working on. And once you've passed them all, you print out a certificate that shows you've done everything. And when y'all finish the online piece, you will have completed the IHI Open Schools Healthcare Improvement and Patient Safety modules, so certificate program that's part of what we do here. But we'll get into some more details on that in a second. But that's what we'll do in class on that day. Then I'm going to do an antibiotic review. We've done some things before. I'm going to abstract it. I'm not going to go into all the big details, but the same handouts we've had before, but I want to just go over some big themes again, because that's another topic that shows up everywhere, and if you had to sit down and think about it, it's still probably scattered in your mind, and we kind of need to bring it back to where it's less scattered in your mind. And then after that, there will be an introduction to business courses in the clinical phase. If you talk to some of your friends, you know that there are 5 business classes that are offered. They are offered online, and you have to take a test and do a little writing project for each of those. She's going to talk about what that is, what that looks like, and how to think about doing it. So that's another setup for the next year. Then on Friday, Dr. Latassi has a prescription writing activity and a medication history activity that she's going to do in class to kind of go over how to get information that's worth having. You know, it's hard to assess therapy and start new therapy when you don't even really know what's happening. And you've seen this in Good Shepherd, what you think is happening versus what's really happening, or nothing at all is going on. Then on Friday afternoon, there's skill development, stereo technique at the Healthplex in Norman. We will be giving you a Google Earth on exactly where to go to, but you'll get specific directions. But you're in 4 groups of 9. It's only a 1-hour thing. When you do your 1 hour, you're over. We'll tell you where to gather, when to gather, and then you'll be taken into a place and learn how to scrub, gown, be sterile in all the way you approach patients in an operating suite. Okay? Then, Monday, Tuesday, and Wednesday. Monday, I've made a change for some of you folks who looked at this. I changed it. We're going to have a written examination in this class. There will be, for all the topics that are presented, all the in-class presentations will have specific objectives, and those things will move forward. So skill development, those preparatory sessions we have, those slides can be a basis for exam questions. The IHI Open School, there are objectives already set up for all those topics. Those are a basis for examination. You know Dr. Latassi's objective deal. She'll have, the lady will have objectives, so you'll have all of this stuff out there. And those, all of that in-class presentation stuff and the online modules that you do will be a basis for in-class tests. It ain't gonna be a big deal. I suspect it's an hour or less. I suspect it's probably gonna be 60 questions, something in that ballpark, as best I can tell right now. And then, after that, you get a little bit of a reprieve, and then we're doing the pack rat. This is that big megathon that happens. It really deals with all of your knowledge across the organ systems, your diagnostic skills, your assessment skills, your patient assessment skills, your physical diagnosis, all these things. There's a test, pack rat, physician assistant, clinical knowledge, rating, and assessment tool. That's an online thing. We will register you for it, and we will have it blocked off from 12 to 4. We're going to do a 4-hour block for you. And then for those who have accommodations, there's a way to get those for this too. So it could run from 12 to 6 if you were going to do the whole ball of wax. So it's a 4-hour block that we're allotting for it. And then if you want to access accommodations, if you have those, then it could be as long as 6 hours. You don't have to. This is not graded. This is not a part of your class. You need to do it because you need to see where are you. You know, where am I weak? This is one of those mirrors. This is the first mirror, self-assessment. And a report will come up the same day you take it. I mean, it's very quick. So it's very much like end-of-rotation exams. You take those tests, and within a couple of hours, you already know what the scores are. Then we kind of communicate those out. It will be grouped in all kinds of categories: cardiovascular, respiratory, physical diagnosis, medication therapy, interventions. There's a whole bunch of different categories that pop up on that deal. So it really becomes for you a roadmap. Where are you, where you need to be, and where are you kind of off the mark. And this would be a very good thing to help you get ready as you do rotation by rotation. I think it's a fantastic thing to have. It has no harm on it, does not cause you harm, but it does help you know where you need to work on things. Do you need to study for it? We debated that this morning. I'm still not sure what the right answer is. I know some people will study for it. It's okay. It's not, you don't have to study for it. If you want to study for it, you can. You're not being asked to study. And program director, Dr. McNeil, feels like you ought to walk in there and just take it, see what you know. What can you actually recall from all of this year of stuff? And there's a lot of stuff. So you can just walk in and do the test and see what it is. If you want to study, fine. I'm not going to say, Sally, Nikki, was there ever an agreement to it?
I mean, there's not a right or wrong answer, because you can study and say you're studying for rotation. So, I mean, you're basically refreshing your memory.
If studying helps lower your anxiety level about it, I think that's probably okay.
Yeah.
That's the type of test taker I am. I need to have a...
And I'm like, I'm going to wing it, I'm going to go and take it.
I think that's really good. It's not required that you study. You're really not competing against anybody.
Right.
There's always competition in classrooms for grades. I don't care, since the universe was made and somebody figured out that we're doing tests, people are competing with each other. You are not competing with each other on this exam. You are competing against a national standard on the exam. That's the way you need to approach PANCE. You aren't competing against somebody, you're competing against the standards set for those exams. There will be an EOR standard, there will be a PANCE standard, and so you need to prepare yourself to kind of meet those standards. This test is self-assessment. It doesn't count. But I will tell you this, if you do, it will give you a score, and there is a correlation between this score on this pack rat and how you do on PANCE. So if you're at a certain level at this point 1 year in, and it looks pretty good, then if you keep working like you're working, you're probably gonna be okay for pants. If you come out on this exam and it's way down here in the basement somewhere, then, you know, your anxiety level probably does go up. Because it may mean that unless you do a different type of studying or get more prepared, you may not do as well. So I'm not trying to make you nervous about this. I want you to understand what it is. It's helpful. Okay. Professor Brooks, you had your hand up.
Oh, well, we were just talking about that. If on the pack rat, it also does spit out what areas you need to work on. If you just go in there and take it, not studying, and it helps you determine what areas you're lacking in, that you could go ahead and then study and focus on more that maybe you didn't do well on the pack rat. So it is like a self-assessment. It helps you determine where you're weak, yeah.
Yeah, it'll be interesting. If you want to study, like Professor Roark said, go ahead. If you don't want to, you don't have to. Okay, just know what you're walking into when you do it. Okay, but you will get a report back, and you will know how you stand. We will try to give you as much interpretation of what the numbers mean as possible. They tend to bring it up. We tend to get the information as scores per student, and then each category, there's a category score, and then they will give you the national standard score. So let's say cardiovascular interventions, the national standard might be 74%, tends to be one of the lower ones. Okay, let's say you made 55. Okay, then you're pretty much far off the mark to what the national standard is, because that's the average of a bunch of programs. If you make 85, then you're probably above the curve on that one. And I guarantee you, it will be unusual for somebody to be on the standard all across the whole test. You usually find a lot of good stuff, and you find some little low spots, and you find some high spots, but that's pretty much the way it's going to look. So you can't worry about it, just it's directive. Okay? Anything else y'all add about that? Okay. So at first I had pack rat thinking, oh, you'll want to come in here fresh and ready to go, but some were saying if we have a test on that day, and it's the only day we can do the test because the content won't be done until the Friday, and then we've got that test block on Monday with the pack rat, then the OSCE is an all-day affair when we get to that. The test will not be horrid. You'll have to study stuff, you'll know stuff, but it will not have the same feel as a module exam. The content is important, is useful, but you're not going to have as much to mess with. Okay, you'll be okay on that one. So, but we decided to go ahead and give the test for those who want to study up to a point and do the test good. Don't get nutted by pack rat, and then we'll come back and do pack rat. You have a couple hours to kind of walk around, and go take the test. How exhilarating. Monday is going to be a test day. Okay, and then Tuesday is the OSCE day. And I'm going to just give a little brief intro, then we'll let Professor Brooks and Professor Roark have prepared a little presentation on that. But there will be 2 OSCEs per student that will be done, and your OSCEs are back to back. So you might be the 8 to 9 whatever person. You'll do one, and then you'll do another one, and then you'll be gone. Everybody will do it with 2 different patients, 2 standardized patients, and 2 different faculty, so you'll not be in the same room with the same person doing stuff. Because there are issues with that sometimes. Sometimes the faculty member makes you nervous and you'll be better off with somebody else. Sometimes, you know, SPs are odd for you, okay? You know who they are by now. And I've heard, everybody's laughing because y'all know there's some people who kind of hawk at you and some people are just kind of easy to work with. Okay, well, welcome to patient care. I used to always schedule my most difficult people at the first of the day because if I could get out of the room with those folks, the rest of the day was easy. But if I knew they were on my book at 3 and 4, and just all day, they're just going to eat me up. Because I know the type personalities. So I like to always put them together. It was always really bad though when our scheduling clerk put 2 of those people back to back. What have you done? I was like, I never ever put these people back to back. This one sticks their tentacles in and sucks your life force out, and then I've got nothing. And then the second one sits down and they got me. I have nothing left. Okay, good people, hard one, good, maybe a hard one. I cannot do those hard people back to back. It's different. Okay, so you'll have 2 of those, and then. then that's it. So you'll be in there for about a block of about an hour and a half or something like that, then you'll be gone. And then the next day, you get a debrief with the faculty member who was with you last. There'll be 2 faculty, so the last person you're with would be doing the debrief with you. And it'll just be more helpful. Here's what you do good. Mostly it'll be good stuff. Y'all have always done very well as a class. That H&P week that had that, kind of walking and do your thing, y'all did really well on that. So I expect y'all will do really well on this as well. But then if there's areas for improvement or problem issues, they'll kind of identify those too before you move on to rotation. So the OSCE is self-assessment time, but this one does have grade implications because it's 15% of your grade. And then you'll get a debrief from the faculty member who saw you do it to talk a little bit about pros, cons, things to work on, where you are. And mostly, I suspect, most of you are where you need to be at this point anyway. It's a process, okay? And you're kind of a year into the process, and we'll look and see where you are, and then you'll get a lot better next year, and then you'll be fabulous, okay? And I will always wear a necklace that says, if you graduated from OKCU class of 2019, do not let that person touch me. I know. Okay, no. Now, there are a few students over the course of my life that I never would want to touch me. But I don't have that right now, so don't make me go there. Okay, right now y'all are not on my necklace, okay? I don't want that. Oh, goodness. Okay, do y'all want to come down and give a little bit of detail on the inside of that, and then I'm going to come back in the syllabus and we'll look at how that thing gets graded out. If y'all want to go take a break, y'all can do that. Do y'all have any questions over what we've scheduled so far in terms of how the things are going? No?
Hey guys, really fast, you guys got an invite from Music In, let me know, I can resend it, but for the end of the year party, if you haven't responded, please respond, we're trying to get a head count and all of that, so.
Yeah, we used to get out of it.
Yeah, I sent it to your, it might have went to your junk. It's by e-bike.